Welcome to the World of Rare Disease, a show that focuses on awareness and education about rare and complex disorders. My name is Lisa Deck. I am a patient, an advocate, and a committee member for Rare New England and your host for today's show. The acronym RIPIN stands for Rhode Island Parent Information Network. Today's show will discuss the history, mission, and programs available to parents, families, and children through RIPIN. My guests are Tara Townsend-Hayes, RIPIN's Family Voices Coordinator, and Susan Donovan, the Director of Training and Information. Tara has been with RIPIN for the past 9 years and also serves as a caregiver to her 11-year-old son. Susan works collaboratively with Tara and directs RIPIN's Training and Information Office. Welcome, Tara and Susan.
Thank you.
Thank you, Lisa.
In your own words, could you tell me a bit about the mission of RIPIN?
Sure. So RIPIN's mission is to really help all individuals in the state. And we do that through advocacy, education, peer-to-peer support, and we really don't only embody the mission, but the vision of RIPIN, which is really to move the systems of the state forward to really incorporate that peer-to-peer model, that peer-to-peer perspective, and develop programs throughout the state that really meet the needs of all Rhode Islanders.
Wonderful, that's great. And I understand you've both been with RIPIN for many years. Could you tell me a little bit about how it was started?
Sure. So RIPIN is a 27-year-old nonprofit agency, and they originated with just a handful of parents and a couple of professionals that were navigating systems of care, and particularly education, for their children with disabilities. And it started with one program from the U.S. Department of Education, which we call the Parent Training and Information Center, and then it's grown since then. Now we have multiple programs and various initiatives out of those programs. I've been with RIPIN for over 16 years. I like to say that my children brought me to meaningful work, and the mission has kept me there.
Excellent. I love that. That's wonderful. It's a nice way to put it, that you joined and was part of it, and now it's something that you love doing. So I know we've talked in the past, there are so many pieces of the organization, and I was wondering if we could highlight a couple of those for the audience. One of the things that I think stood out, and I think our viewers would love to hear about, are the guides that are available for patients and their families. Could you elaborate on that for me?
Yeah, so Family Voices program within RIPIN, it develops a lot of resources for families with children with special health care needs. And when we say health care needs, we're encompassing all needs, whether it's physical, mental, emotional, social. And so a while back, they developed the Family Voices Connecting the Dots guide, which is a navigation guide to work through systems and services in Rhode Island when you have a child with special needs, whether it's recreational or educational or therapeutical or community-based. And so we've been updating that every year since 2008 now. And obviously it's evolved a lot, and we've added live links and things like that to the website version of it. And then recently we found that a lot of our parents and caregivers were looking to have more connections to other parents and caregivers that were facing similar challenges. So we developed a Making Connections guide, which is for to learn about support groups throughout the state. We also have a number of other guides when it comes to healthcare transitions and things like that, and they can all be found on the resources site of RIPIN's webpage. But we do have a lot of programs that support not only families with children with special healthcare needs, but individuals and older adults throughout the state. So our programs really do go the breadth from life of the life cycle. We are the sole source of parent consultants for early intervention program in Rhode Island. So we have a parent consultant in each of the early intervention sites. Then we have a program known as the Cedar Family Center, which provides intensive care coordination for families who are facing a lot of issues and challenges and some crises when it comes to behavioral health and emotional health. And then we have the Parent Training Information Center, which supports the special education piece. We have Family Voices that supports the healthcare piece. We have the RIPIN Call Center, which I think we're going to talk a little bit more about. And then we have the Ombudsman program and the Healthcare Advocate, which helps individuals who have Medicare and Medicaid.
Right. It's interesting because when I talked to you about this show, I was blown away by how many programs exist. And it seems like this is kind of your one-stop shop when you have a child with disabilities or you need something as being disabled or, as you said, kind of throughout your life. So I do think RIPIN seems to have a variety of options and things available to patients and their families. Could you, Susan, talk a little bit more about the call center and peer-to-peer support? Because
Sure.
I also know as a patient, having peer-to-peer support is very important. So I'd love to hear about that.
It really is. Our call center is really the hub of the agency. Folks are calling in whether they have questions about their health insurance, any type of health insurance, whether it's commercial, Medicaid, or if they have no insurance. We're there to help connect them and help them access, their health insurance, as well as if they have questions around school, special education, or working with their teachers, in addition to looking for community resources. And so our call center works in conjunction with all of the departments, all of the programs within the agency, and they're really able to do a good initial assessment of what the caller, what the consumer is looking for, so that they're connecting them to the right people at RIPIN. We do warm transfers. We've got staff working together so that it doesn't matter what door you come in at RIPIN, that you're connected to the appropriate resources. For things that we don't have, for supports and resources that we don't provide, we have partner agencies in the community and throughout the state of Rhode Island that we can make referrals to and work in conjunction with. Often we're working with families that have multiple issues going on, and that may include a staff person from RIPIN and maybe a staff person from one of the local, community health centers or another agency, and that's very helpful. RIPIN is the largest employer right now in Rhode Island for certified community health workers. We're happy we engaged on this path back in 2016, and we focus on different branches, so to speak, of community health care, looking at whether it's special education, health, elders, aging in place, and we're able to connect folks who have experienced what our consumers have experienced. And right now, 65% of our staff are peers that have been caregivers in one aspect or another, or they may have a condition themselves that they've needed to navigate multiple systems of care. And there are things I know as a parent, when I was going through my challenges with my children, when we were on our journey, I felt a lot more comfortable speaking to a peer who understood what I was experiencing and going through. It can be very intimidating when you show up at a school meeting or at a doctor's office and you have all professionals around the table and you don't understand the lingo and they're just not speaking your language. It can be very intimidating. So we like to level the playing field for families and individuals, and making sure that they're empowered, they know their rights and responsibilities, they know that they're an important partner in their child's education or their child's health care or that of their elderly parent, and really helping to support those folks so that they understand how to navigate and be part of that team.
Right. Wow, again, I'm blown away with all the things that are available, and it's great to know these are available. Talking just about the mission of RIPIN, is there anything else you would like to highlight that I may have missed, or do you think we've covered the highlights?
The only thing I'd like to say is that, when I first came to RIPIN, I learned very quickly that if you didn't have the answer to a question that, somebody was calling in and asking you, you had 100 other people around you that can support you to provide you with guidance towards that. So, not to ever be afraid to say, I need to do my research, I need to, check into this. And, almost 99% of the time we would be able to find the resource or someone to connect the person to, which was really valuable to me because, we don't have all the answers, and there's so many new programs and new things going on, and you only know what you can know. And I think as a peer, you're more valued when you say, I just don't don't know, let me search for you and do the legwork and try to help people. And I think RIPIN really does that. We really try to meet people where they're at and follow them through the case till completion. And we have many families who, you know, come to our doors and it's a one-time call or something like that, but we also have a number of families who stay with us for 6, 8, 12 months, and we've been running the RIPIN's peer-to-peer connection support group for almost 7 years now, and we've had some families who have been coming for almost 7 years, and it shows, you know, the value of that peer-to-peer support and how meaningful it can be to just have somebody else beside you who gets it to listen.
Right. And I think this actually leads nicely into the next question. I was going to ask you about what is the biggest benefit to the patients and caregivers that come to RIPIN by using your services? What would you, I mean, I'm thinking it could be the peer-to-peer support, but is there something else? What is the biggest benefit?
I think we provide support in various different ways, different tiers or different levels. So, I mean, you can call with a quick question, you can come in person and we can sit down and work with someone and go over paperwork, explain to someone, you know, if they have questions about their health care, if they have questions about a school situation or resources that they're trying to navigate. We have a wonderful menu of workshops and trainings that we offer to the public at no cost for our families. And those workshops include topics such as policy, you know, what to know about policy, how to become involved in influencing policy, self-advocacy, special education, bullying, you know, what to do when your child's being bullied, early intervention, and transitioning from early intervention to the school system. So we have various different workshops that are very popular, including what to do after high school, you know, kids with disabilities that are transitioning into adult life. So I think the different levels of care that we have, the different types of support is very beneficial because you're apt to find something that meets your need. The peer-to-peer, that's something that we've built on that has been very successful and has been welcomed by the community. So I think that's very important as well. But when we work with families, as Tara said, it may be just for a few months, it may be for a year, it may be on and off for several years. We have families that have raised children over the lifespan. We have a number of grandparents that are raising their grandchildren. So I think having consumers just know that we're there and being able to call and knowing you can call back again anytime, you know, and often they do. And we do have folks that are involved with us for different reasons over the lifespan.
Right. It's interesting because here we are talking about rare diseases on our show, and I think rare diseases and disabilities often go hand in hand. So I think knowing that this exists is such a privilege for all of the viewers to know. And I understand they have this in every state. Could you talk a bit about that?
Sure. So there is a Family Voices and a family-to-family health information center in each state. As far as RIPIN goes, there's not necessarily a RIPIN in every state. There is a parent training information center in every state. And those entities, Family Voices, Family-to-Family Health Information Center, and the PTIC, sometimes come as a one-stop shop, as they do here. But in many instances, they're in a couple of different agencies or organizations. So, you know, it's sometimes a little bit more challenging to navigate. But we also welcome calls from people from other states because if they somehow find our number, we know that there's a Family Voices in every state. We know that there's a Family-to-Family, and we know that there's a Parent Training Information Center. So we can just easily look on the website and, you know, guide them towards their state's resource that's similar to ours.
Well, this is a wonderful resource to know about, and I have to say I didn't know about this just a couple months ago, so you're educating me. My parents are in Rhode Island, so it's good to know. But I do think this is valuable for anybody who is looking for assistance. So thank you very much for being here. I think these are great resources to know about. We are very, very lucky that you took some time today, so thank you.
Thanks for having us.
Before closing, we provide our viewers with an opportunity to share comments or ask questions from our prior shows. Rare New England in Motion is the perfect way to expand upon our mission of engaging with our community. Please send us any questions or comments about our shows to info@rarenewengland.org. We will share your responses on our next show. In one of our last shows, we received a question asking if all legislators are aware of the Massachusetts Rare Disease Council bill. Unfortunately, while all legislators were sent a copy of the bill, not all of them are aware of its status and importance. Rare New England, along with the bill co-sponsors, encourage all Massachusetts constituents to reach out to your legislator to let them know about this bill. This will help us move it forward. Thank you for your inquiry. That is our show for today. From all of us at Rare New England and all the patients and families who keep rare disease in motion, thank you for watching. And remember, when you hear hoofbeats, think horses, and then think zebras. Thank you.